So I was born in San Antonio, Texas. My parents are Southern Baptist music ministers. And when I was 3, we moved to Tulsa, Oklahoma. So I remember pretty much growing up in Oklahoma my whole life and being a minister's kid. And so there are definitely ups and downs with that. But one thing I learned from them is really the true nature of a profession and dedicating yourself to whether it's a craft or a ministry, and their dedication to the church members of their congregation. And my parents were on staff at the church for over 30 years and recently retired. And so I grew up in that environment and took my education from high school in Tulsa to Oklahoma Baptist University in Shawnee, Oklahoma, and then the University of Oklahoma. So I was a tried and true Okie growing up and still a big OU Sooners football fan. You know, going into medical school, I always knew I wanted to be a surgeon, but ophthalmology really wasn't on my radar. Since I was a kid, I always knew I wanted to be a doctor. Since 3rd or 4th grade, my little basketball coach was a general surgeon and let me shadow him and helped me with internships in college and getting into medical school. But ophthalmology wasn't on my radar until I did an elective in my 2nd year in neuro-ophthalmology with a doctor named Brad Ferris, who quickly became my mentor to get through into ophthalmology residency. I was really just fascinated by what we could do for people's eyes, and I saw things like relocating muscles on the eyes to fix double vision and doing surgeries to lower eye pressures and how just miraculous cataract surgery can be. And it was when I really saw those things that I fell in love with ophthalmology and taking care of people's vision with surgery. And it really is a cool privilege to be able to do that. And I never even would have thought about it until I got that elective in my 2nd year. One of the things that we learned about in fellowship that was really instilled in us is to treat people like we're their family and do for them what we would do for our mom or dad or our brothers or sisters. And I really like to take that and try to decide what's going to be best for someone and what I would do for them if they were my family member. And I had a patient early on in practice ask me that. She had a complex situation. She needed a couple of different surgeries on her eyes at the same time and was obviously very worried about surgery. And she asked me that question, well, if I was your mom, what would you do? And it was nice to have thought about that and to have been taught to think like that. She really comes to mind when I think of how my training and upbringing led to how I try to take care of patients today. But then residency and fellowship and now work have taken me around the country, up to Philadelphia and South Dakota and now to Florida. But I was lucky enough to take my wife with me through all that. I met my wife Jenny when I was in medical school and she was in nursing school, so the most stereotypical way possible to meet a spouse in medicine. And we were also going on a medical mission trip together, so we found common interests and grounds there, and I'm so thankful that we've been married since 2014, which is when I graduated medical school. When we moved to Florida, we had our 2 boys. William was born shortly after we moved here in 2019, and he's now 5 years old, and Tanner was born in 2022 and is now 2 years old, and it really is a joy to have the boys and watch them grow up and be a daddy to them. And so those are really the 2 main things I do now are be a dad, try to raise our boys, have fun with them, and try to be a good husband and doctor. Fort Myers is a unique place. A lot of people aren't from here. There's a lot of transplants. There are probably more transplants than anywhere in the US here. And so we're all from somewhere else and have moved down here. And so at first I found it kind of hard to find community. But Fort Myers really started feeling like home once our kids were born, once we'd been through a major hurricane and we had to bond together as a community. And now my wife's parents and her grandparents live here. And so this really is home for us. And it's just a really big privilege for us to be here taking care of our community and helping get our patients their best vision.